the Environment Bureau, we have Mr. Jie Junwan, Undersecretary, Mr. Alan Chen, Chief Manager of Housing Department, and Dr. Lau Ka-hin, Hospital Authority Chief Manager. I will first invite Dr. Zhang to report on us the latest situation of the confirmed cases. Today we have 5 new confirmed cases and 1 preliminary confirmed case. The 5 confirmed cases are all imported. 1095 to 1098. The 5 patients have returned from Bangladesh. They are Hong Kong citizens and they all arrived yesterday on KA 734 from Malaysia, or actually from Bangladesh, and then they transit in Malaysia and then to Hong Kong. Case 1095 is a 53-year-old male. In mid-March, he went to Bangladesh to visit his relatives. He lived with his relatives in Bangladesh. He did not have any symptoms, nor did he come into contact with any symptomatic people. Yesterday, he was quarantined at Lei Yue Mun Holiday Camp, and then he became a confirmed case today. Case 1096, a boy, 15-year-old. He is the son of case 1097, a 43-year-old male. The father and son, together with the mother and the sister, went to Bangladesh in January, and they all returned yesterday, and they were quarantined at Lei Yue Mun Holiday Camp, and today the father and son became confirmed, while the mother and sister were not cases. Case 1098, a male who is quarantined in Lei Yue Mun Holiday Camp. In March, he went to Bangladesh with his son, and he had no contact with other patients. After being quarantined, he had a fever, and then he is being transferred to hospital as we speak. Case 1099, a 33-year-old male. In February, he went to Bangladesh on his own. He had no symptoms. He went there to visit his family. After returning to Hong Kong, he did not come into contact with his other family members, and he was being quarantined in Lei Yue Mun Holiday Camp, awaiting to be hospitalized. And we are following up on the Lek Yuen Estates cluster in Sha Tin. Today, we identified 1 more preliminary case, a male 72-year-old. He lives with his wife and daughter in Luk Chun House, Lek Yuen Estates. On the 1st of June, he submitted a deep throat saliva sample, which returned negative. In the afternoon of 3rd June, he had a low fever, and this morning, he was sent to A&ED on an ambulance, and he is tested preliminary positive. He has high tension and diabetes, and is attending follow-up. He usually stays at home. His wife suffered from a fall injury lately, so he stayed at home and took care of his wife lately. He did not go out usually, and on the 30th of May, he did go out to meet a friend. But he met the friend outdoor, and they just spent a few minutes together. Both wore face masks. The wife and the daughter are asymptomatic. We have found that the unit of his flat is also of number 12. There was a case of a couple before. They also live in flat 12. And also there was another case in the cluster living in flat 12. So altogether there are 3 confirmed cases living in flat number 12. And previously there was another case who lived at flat number 10. Upon discussion with experts, we want to be prudent, so we have evacuated the asymptomatic households living in flat 10 and 12 on the same floor of Luk Yung House, and they are they have been sent to quarantine centers to receive 14-day quarantine. Of course, if they show symptoms, they will be sent to hospitals for isolated treatment. We will investigate whether there are other problems with those flags, for example, pipes, and the relevant departments will be responsible to do that. Later on, Mr. Jie will tell us more about the situation. As of now, we have collected 1,200 sample bottles from Luk Yang House residents, and they are all negative. And we have been following up with the residents and urge them to return saliva bottles. And there are still 6 outstanding households which we are yet to be able to contact. We have asked the help of police to find them, and we have issued compulsory quarantine order to them for a mandatory test. If residents see our messages, I urge them to come to contact us to receive a test. In Luen Yut House in Kwai Lun Estate, we have collected and tested about 1,978 samples. All are negative. We have evacuated households in Flat 10 and 12, but we urge other residents to pay attention to the health. Like the preliminary positive case, he returned a negative result at first, but when he found that he had a low fever, he went to a hospital for receiving a test. Even if there is a negative test, there's still the incubation period. So if you have symptoms, you need to go to a doctor and receive a test again. If you do not have any symptoms, well, for those residents who do not have symptoms, we are going to test them 14 days later. Now, I'm going to invite Mr. Jie, the Undersecretary, to tell us the results after visiting Luk Yang House. Good afternoon, media friends. In the small hours of Tuesday, Dr. Yuen Kwok-yung and I, together with the CHP colleagues, went to Luk Chun House and looked at the situation. We knew that there were 5 cases. We suspect the origin to be a case living in Flat 12. And there were 2 other cases who lived on the same floor with that flat. And there was another case living on an upper floor above Flat 12, and there was another case living downstairs in Flat 10. When we paid a visit, the 4 suspected contaminated households, we found that the gas pipes and also ventilation windows are not damaged, nor did we find any problems with them. And also the 2 units on the same floor are opposite Flat 12. So their drainage system are separated. So the virus would not have been transmitted through the drainage pipes. So we think the most possible route of transmission is environmental. So we have been looking at the entire building. We have checked the access to the building and also mailboxes. It is also one possible route of transmission. When people use mailboxes, if your mailbox is near the origin household, then you may get infected. So that's why we decided that there's no need to evacuate the residents because of drainage system. But to be prudent, we have 2 follow-up actions.
To play safe, we still need to do some follow-up work. For example, at the joints, we took some samples from the pipes, and it showed that there was no virus found. And then I'll then defer to my housing department colleague. They started to do further investigation with regard to other units concerning the pipes and so on. So further work has been done, but then today, Dr. Jiang notified us that, right up upstairs of the source unit, there was also another preliminary confirmed case. That being the case, given the fact that for flat 1 and 2, well, there are already 3 units in the nearby floors or stories. So they are the same orientation and the same pipes connecting the 3 units. They have been infected cases from these units. So we haven't really checked the circumstances inside those units, but then that already make it plausible that the pipes could also have been one of the sources or routes for transmission. That's why we have already looked at flat 12, so we have evacuated the household there. And then the housing department colleagues will then be able to go there to do further checking. And if necessary, if there is any damage to the pipes and so on, we can replace it, and we can also disinfect it. So that would be a safer approach. And then for Unit 10, well, from the layout plan, we could also see that, well, in between the 2 units, if you look at the toilets, there's also a gas pipe connecting the 2. And therefore, despite the fact that the chance is not high, still, there is a chance that cannot be ruled out. That is the virus can also be transmitted from the pipe between Unit 1 and 2. And therefore, we believe that the household from Unit 10 would also be evacuated. That's a safer way out. Because for the virus to be transmitted, there can be different routes. So there is no single way or single route. That is the only plausible route of transmission. And therefore, all households should check their pipes and also the hygiene of their own units, and also for the entrances and so on. They would also have to heighten their awareness, because for the virus to transmit, there might be different routes of transmission. Even though we are not sure about the particular route that has been the route of transmission, given the situation, we cannot be over worried or over vigilant. So arrangements will also be made to ensure health for everybody. Okay, Mr. Chen, can you also tell us more about the follow-up action taken by the housing department? Thank you. Well, when there is a confirmed case in a particular housing estate, immediately in the public areas, we will step up cleansing. For example, disinfectants and also the mailboxes, the entrances, the doors, and so on would also be disinfected with sanitizers, and also for the units concerned and the nearby area, we would also go in to carry out detailed checking and investigation. We will check the pipes to find out if there's any leakage or whether or not there are any defects on the pipes and so on. Well, for Units 1 and 2, and also Unit 10, we found out that there were confirmed cases, and immediately we inspected the flats, and basically the conditions were normal. And then a couple of days ago, well, in the small hours of Monday, well, for the household with a confirmed case, the condition was still satisfactory. We couldn't find very serious or major defects. And then after the inspection, we also checked the pipe, and then we tried to pour in some liquid for disinfection. So basically, from what we have seen in Luk Chin House, there are more confirmed cases, so a bit more will be done on that building. As we were told, there were several cases confirmed from that block. So after disinfecting that block, we would then be extending the disinfection to other blocks, so that investigation and inspection would also be carried out to find out if there are any defects, and then repair works will then be carried out. But then, as I reiterated, with regard to the piping as a possible route of transmission, that's only a possibility that has yet been confirmed. And we have also previously looked at all the samples that have been taken from the units concerned. For the time being, there is yet any evidence to show that it's been transmitted through the pipes. But then, to play safe, we will carry out all the inspections that would be necessary. Thank you. Then, Dr. Lau, can you report to us on the HA situation? As at 12 noon today, during the past 24 hours altogether, the HA has reported 20 cases to the DFH, and together with those who have been hospitalized, at present we have 72 patients who are still in hospital for isolation treatment. During the past 24 hours, 3 more patients have been discharged. They are 461, 1047, and also 1065. As of now, we have a total of 141 and also 1 suspected patients who have been discharged. As at noon today, we still have 48 confirmed patients in 10 hospitals. They are being hospitalized, and 2 patients are critical. So they are in Eastern Hospital, that is number 595, and also 1084 in Prince of Wales Hospital, and 46 are in stable condition. As of 9 a.m. this morning, for the negative pressure rooms that have been opened, we have 1,211 beds, and so the take-up rate is 47%, and for 600, and there are 651 with negative pressure beds. The take-up rate is 58%. Okay, please identify yourselves before you speak. Yes, I'm from cable TV. Well, for the number of people that have been evacuated, how many are there, and also from how many households, and how many of them are from units 1 and 2, and then for the case from flat 10, which floor was that? And you also talk about 6 households that have yet to be contacted. So how are you going to follow up on those cases? And if they refuse to hand back the samples, what is going to happen to them? Will there be any consequences? Thank you. Well, we understand that there are 15 stories from 2nd floor to the 16th floor. So from the 2nd to the 15th floor, so altogether 14 stories. And some units have had confirmed cases. And setting that aside, so we're talking about some 20 stories, and some have already moved out, so they have not been there for a while. So deducting those, we have less than 100 people out of the 20 stories or so. But then for the accurate number, we will have to do further calculation before we can give you the exact figure. And then we have already resorted to different ways to approach them and contact them. We have also asked the police to help, and we have already enhanced or tightened up the quarantine order. But then we will have to trace them further, because we have not been able to reach them by phone or by direct approach. And there were some units that could not be contacted, but then subsequently they already contacted us, and the most important thing is to get the samples and get them tested instead of trying to punish them. Yes, we have already worked with the police, and we have already contacted them several times, but then some of them are no longer in the households or units. Some have left Hong Kong, or they are no longer living there, and therefore we will have to rely on the police to see if they can find them, and then as soon as we can reach them, we will try to get the samples and then get them tested, because we are not trying to punish them. We're just trying to get the samples and get them tested. That's it. Next, the second one from the 3rd row. Yes, I'm from Oriental Daily. So do you mind telling us more about the confirmed cases? Which unit are they living in? Which floor? And also, well, concerning the environmental samples for Unit 10, well, did you get any sample from the gas pipe and so on? What's the findings? And also, just now you said that you do not rule the possibility that in the main lobby, in the entrance and also the mailbox, there might be environmental infection or contamination and so on. So how come only those living in Unit 10 and Units 1 and 2 have been evacuated instead of the tenants in the entire building being moved to the quarantine center?
I think I can't tell you the exact floors and units because it involves privacy. I can tell you that the original case is in the middle of the building, and there are 2 confirmed cases upstairs and downstairs. The 1-2 unit is upstairs, and the 1-0 unit is downstairs. We are looking at whether there are any structural defects. in pipes and in other pots, so that people will still get infected even if they have performed proper hand hygiene and prevention measures. But if the management company has done a lot of disinfection, then it will reduce the chance of environmental contamination. But for things out of our control, like pipes, we are still investigating that, because for those aspects, there's not much that residents can do to prevent an infection. Maybe Mr. Jie can supplement. Like Dr. Zhang said, of course, disinfection can remove environmental contamination, and people can wear masks to prevent infected and perform hand hygiene regularly. But if there is a structural defect in the building, we need to find out the defects and carry out rectification. So we need to evacuate those residents on the same floor to carry out the investigation. On the night of the first, we took environmental sample from the surface of the gas pipe, because we cannot get inside the gas pipe, and the sample came back negative. Next question, please. On the 8th floor, there are other confirmed cases. Do they live in units 10 or 12? If so, do you need to evacuate people on that floor as well? Why did you not do that? Unit 10 and Unit 12, do they share the same pipe, or do they have different pipes? What direction will you be looking at when you take environmental samples to find out the routes of transmission? And what about the Lake Yuen shopping malls and wet markets? How many deep throat saliva samples have been collected, and does anyone come back positive? And have you tested the serum of the paramedic? Have you tested the serum of the infected paramedic? And do you need to do investigation in Fook Hoi House where he lives? The 8th floor. The two households on the same floor of the original household, they are not units 12, but they are quite near the flat. So we suspect environmental source of transmission, because they are located on the same corridor. It may not have to do with pipes, because they are living opposite to the original flat. So we are not asking them to evacuate yet. But of course, we are worried about all people in the building, so we appeal to them to pay attention to the health. Even if they return a negative sample, it doesn't mean that they are fine. Like the old man, his fever was very low. It seems that it was only 37.3 degrees Celsius upon hospitalization. But because of his prudence, he was screened as a patient. And we are still collecting samples from wet markets and elsewhere. There are scores of samples being collected, and there are no positive results yet. About the pipe of 1012 and 12, Mr. Chair, please. For those two flags, the soil pipes are different, so they do not share the same pipe. But the design of the building is such that there is a ventilation or exhaust points of the soil pipes. So in case of flushing, the air can leave the pipe. And there is a connecting pipe between the soil pipes of units 10 and 12. So that may be a channel for air exchange between the two soil pipes. Normally, if the pipes are intact, virus will not be transmitted. But if there are any modification or defects, it is possible that it may happen. So that's why we would like to evacuate those living in Units 10. Case 1088, he's a paramedic. On the 31st of May, he went to the A&ED. He was asymptomatic, and he was given a COVID-19 test. The result was weak positive. That's why we took him in to our isolation ward for observation. He had contacted one of the confirmed patients, so that's why we gave the paramedic a serological test. The result was negative. So no antibody for COVID-19 was found. Since yesterday, he developed a fever and he has headache today, but the lung scan came out clean. Upon the advice of microbiological experts, the paramedic is beginning to develop antibodies. His symptoms developed only yesterday, so we are still keeping the patients in hospital for observation, and we are giving him more tests. We will keep close eye on his situation. An English question, please.
Thank you. Two questions from RTHK. So could you tell us why the underlying structural problem at the block in Sha Tin was not discovered when you inspect the building on Tuesday? And was negligence involved? And do you expect more people could have been infected because of the delay in evacuating the people? And secondly, could you explain to us in English why only residents in flats number 10 and 12 have to be evacuated? Thank you.
Okay. I think we are speculating that this is a hypothesis that units 10 and 12 there may be a structural problem that can explain the transmission vertical among the residents of the units. And that's why we, as a precautionary measure, we would like to evacuate the residents of these two units so that a more thorough inspection and investigation can be carried out to ascertain whether there's any structural problems along the pipes and the drainage that can explain the possible transmission among these units. Yeah.
Right. Well, as to the first inspection, I have explained, I think, at the very beginning that when we inspected the units in the morning of Tuesday, there were 4 suspected units to be infected. Yeah. And 2 of those units are located at the other side of the corridor of the building. Yeah, and they are completely separated from each other, and therefore there's no way for any virus to go from one unit to the other unit through the sewage system, and therefore we were very confident that for those units, the structural problem was not the source of the transmission. Yeah. And as I've said, to be safe, we have also collected samples from all the units, all the vents and connection joints, etc. And all the samples shows negative results. Yeah. And therefore, we believe that the environmental factor was dominant in these cases. And I've explained why mailboxes and corridors or doors, etc., probably are the more likely pathway of transmission. Yeah. And however, today we have heard that there's another unit in the building sharing the same sewer system. It's also confirmed to be likely to be infected. Yeah. And if that is the case, then we have 3 units sharing the same sewage system. Although we have not discovered any defects yet, but we cannot ignore there is a possibility that there are transmission through the sewage system. That's why we believe it is safe to evacuate all the residents connecting to that soil pipe for to enable a thorough check by housing department colleagues on whether there's any defects on the soil pipes, and if there's any, then they can rectify it and clean it before our residents come back to the units. Yeah.
The one in black.
The first question, you said that this is a speculation and a hypothesis at this moment from you that there's a problem, structural problem with the sewage system. My question is, there were already 2 people in Unit 1-2 that were confirmed a few days ago. And given that now you still haven't found any structural problems by Mr. Se, whether it is the joint or the other parts, and all the environmental samples have so far come back negative, why have you not arrived at this hypothesis a few days ago when 2 people in Unit 1-2 have been confirmed, but why have you changed your hypothesis now that 1 more patient has been confirmed? Have you acted too slow? This is my first question. The second question is, why don't you evacuate more residents in Luk Chun House? Because couldn't they have already been, the virus have already been transmitted to people in other floors and other units as well, not just 110, 10 and 12. The problem is, they might have similar pipes and similar joints in those floors and those units as well. So if there's only 1 person in other units and other floors that have that problem, that could, in theory, could it not, also transmit to people on other floors? So why don't you evacuate more? My third question is, how many residents have so far already left Luk Chun House? Do you have that figure? Because we know from media reports that on the first and second day, a lot of people, because you haven't quarantined them, a lot of people have already fled the Luk Chun House because of fear of getting the virus. So are you worried that there is a wider community outbreak? And also given that there are 6 primary schools nearby, and there are also shopping malls and so on. Do you fear that there is a wider community outbreak, and how do you plan to find all those people who have left? Thank you.
Because we do not have any evidence of structural defects among this building yet, that's why the hypothesis, the route of transmission through the pipes and the drainage system is a hypothesis. So because we have 3 units affected, I think the chance of purely chance by chance of occurrence is much lower. That's why we plan to evacuate them to be safe. So in the first day, when during the 1st of June, the joint visit led by Professor Yun and Mr. Jie, at that time, because the 4 units are quite they are not vertically staggered, and some of them are in the same floor of the affected unit, and 1 is above and 1 is below. So it is very difficult at that time to arrive at a conclusion that the pipes are problematic to explain the units affected. That's why at that time we took some environmental samples just to make sure the pipes are not affected at the moment. But now we see another case, and so we have 3 cases in one unit direction. So it's very difficult to explain purely by environmental contamination. That's why to play safe, we will evacuate the units, the residents. And for the other units, we will observe the situation, because we have taken the samples from all the residents, and all of them come back to be negative so far. That's why we ask them to observe their symptoms and to seek help, seek medical advice as soon as possible. And I do not have figures how many Luk Yun estate residents have left the building. But we try to chase all of them to submit their saliva, and so far only 6 units are unable to reach them. We have not able to reach them, so we try to seek help from the police to try to locate them, to ask them to submit the saliva. Yeah.
Next, third row. I'm from Apple Daily. Good afternoon. Just now, some colleagues have already asked, is it a bit late to evacuate the residents? Because I heard that some residents were very scared and they went to hotels to stay. So would that also lead to community outbreaks? And also for this elderly gentleman, all right, he was first tested negative and then now is positive. So is it that he didn't give the right saliva sample, and then afterwards you tried to get sample from his nose, and that's why the result was positive? So could it happen to other residents? So would you consider taking the second sample from the residents, so that before the outbreak you can ask them all to go to Junyang Estate for quarantine? And also, well, Dr. Ho Pak Leung said that 4 types of people should not be going there. So would you suggest that when people join the candlelight vigil, because today is June 4th, would they be not suitable, and therefore you would give them further advice? Well, the 72-year-old man, he gave the sample on the first, and it was negative, and then on the third he gave the second sample, and then he started to feel unwell, and then it's understandable, because when you gave sample, if you look at his condition in the afternoon of the 3rd of June, even if he was infected, on the morning of the 1st, he already gave us a sample and it was negative, and now it's been tested positive. It's understandable. Is it that giving the deep throat sample would be better, or giving the sample from your nose? Which one would be more accurate? In fact, when you look back, well, sometimes it could be vice versa, because when you gave the throat sample, it could be negative, and then when you gave the nose, it's positive, or vice versa. So it could happen either way. Well, for the time being, we are still of the view that for the pipes, if there are structural defects, then we are not sure if that might have been the cause. If that's sure, then of course we should evacuate all the residents. But then, well, there are asymptomatic patients and environmental contamination and so on. So that's inevitable. So everybody should pay more attention to personal hygiene, and therefore it cannot be waterproof. But then what about the candlelight vigil? I do not have specific advice for people attending the vigil. So you will have to ensure that there is sufficient social distancing. And if there is no necessity, then you should avoid contacting people. And you should also ensure personal hygiene and also disinfect your hands sufficiently and so on. Okay, I'm from RTHK. Experts have suggested that even for those living in Luk Chin House, they should be subject to 14-day home quarantine and so on, or they should be subject to further testing and so on. And if you do not do that, what are the reasons? And also some experts also suggested that they should be wearing a face mask when they go out. So that should be made mandatory. So why not? And also, there are some 20-odd households that could not be contacted, and now only 6. So when they give the samples, could it mean that some hidden patients have been released? So would you be taking remedial actions? And also, in Hong Mei Lau and Hong Mei House and Hong Tai House, you've already inspected the pipes of public housing estates. So on that occasion, which parts of the pipes did you inspect? And if there are problems or defects, would you be widening the inspection so that you would be inspecting more pipes? And also for Lek Yuen Estate, the sewers and so on, actually they've been shared between 2 units. So it's, for example, between 801 and 802 and so on. And on this occasion, you said that the units were opposite the corridor. So why? Well, we'll make arrangements for residents from that housing estate to give the second deep throat sample for testing to find out if there might be asymptomatic patients transmitting the disease.
For medical surveillance, the most important thing is the residents have to pay attention to how they're doing in terms of health. So in the coming weeks, if they feel unwell, they see a doctor, then that's what we call medical surveillance. We urge the residents to call us if they feel unwell or see a doctor. Like the old man, he returned a negative sample, but once he felt unwell, he saw a doctor. That's the best practice. I understand that it is very prevalent for Hong Kong citizens to wear face masks. For example, everyone in the building is wearing masks, so we don't need to make it mandatory. For the residents in Luk Chun House, they are very cooperative. For some cases, we thought they were out of reach, but then they told us that it's actually a mistake on our behalf because we made a mistake in terms of their ID card numbers and names. We're not going to give serological tests yet because the technology is not very mature yet. By doing different saliva sample testing, we can see whether the virus is still infectious. Mr. Chen, about the inspection of pipes, like I said, when there is a confirmed case, we would carry out a thorough inspection on pipes for the pipes shared by 2 units. If you found leakage, broken pipes, or foul smell, please approach our Housing Estates office and we will send colleagues to fix it for you. In Lake Yuen Estates, like Mr. Jia said just now, between units 12 and 10, where the toilets are near, there is a vertical pipe. We call that a vertical soil pipe. So the vent pipe would connect the 2 toilets in the 2 units. But actually, there is a water seal separating the traps. So the 2 units will not be connected by the pipe, provided that the vent pipe is constructed properly. A few days ago, when we inspected the units, we found the vent pipes are all connected properly. And like I said, in units 10 and 12, we have inspected some flags, and generally they are in good. The joints were in good shapes. The joints were sealed with cement, but we have added glues on the joints to make it stronger. So from our inspection, preliminary inspection, it seems that everything was fine. Next question, please. Good afternoon. I'm from Mingpao, Hui Fong Man. When the experts paid a visit to Luk Chun House, 2 confirmed cases shared the same unit's number. And you also found that units 10 and 12 are connected. So at the time, did you check the neighboring units? And also, have you checked the adjoining pipes of the units opposite? Why did you come to a decision that it had nothing to do with structural defects? So do you think there was a negligence? And when are you going to inspect the units of the preliminary positive old man? If his unit was fine, maybe it means there are other contaminated units which spreads the virus through pipes. And you said you have poured bleach into the vent pipe. Can the residents do that on their own? Can they pour bleach themselves into the vent pipes? Is there any way for the residents to prevent getting infected from pipes? There are still 6 households yet to be found. Will the CHP go to their home to find them? Is it too late to ask the police to take action now? So why didn't you set a deadline for returning samples? Are you worried that the 6 households would spread the virus in the community? And a question for the Undersecretary, Mr. Jie. Hong Mei House and Hung Tai House, have you confirmed the routes of transmission in those 2 buildings? I will answer the 6 households first. We are still yet to get in touch with the 6 households. So at 3 p.m. today, we have went to those households with the police and left letters, but still they are yet to be found. We don't know whether they have left Hong Kong before or that they have moved out and did not know that we were trying to find them. For those we could not find previously, we were told by the management office that they have moved out in April, and some have been living in elderly care home. Maybe this is the case for the 6 households as well. But maybe they have moved out, but people don't know. So we are trying to find these households with the help of the police. We don't know the situation yet about the structures. Like I said at the beginning, when we inspected the 5 units, 2 units were located at the corridor, and they were opposite the original flats. The droplets could not reach these 2 units across the corridor. So under these circumstances, it must be something other than droplet transmission. So it's not a hypothesis. That must be the fact. So we are very concerned whether there are any defects with the pipes. On that day, after inspection by me and Dr. Yuen, we could not find any problem or defects. But we have taken environmental sample from the joints of the vent pipes, and they were all negative. Whether this case has changed our judgment, no, because if it is not pipe, the transmission route must be other environmental route. So we must pay extra attention in terms of our personal hygiene when you go out. These units share the same pipe, so to be prudent, we thought we should evacuate all the residents there to carry out investigation. There might be more than one route, except other than environmental route. So we would like to carry out more in-depth investigation to find out the source. And you're already concerned about the evacuation. Our decision depends on the routes of transmission. For many cases, we can perform disinfection, and by being careful, infection can be prevented. So we will not evacuate people for those cases. But if there are any defects in the building, you cannot avoid getting infected by being careful. So we need to find out the problem and rectify it. So that's why we evacuate them to carry out inspection. It is not the case that if we evacuate them, everyone will be fine. No. If we can prevent it by other means, we do not need to evacuate them. About Hong Tai House and Hong Mei House, there is a interdepartmental body under the Food and Health Bureau. After certain incidents happen, the housing departments and architectural or buildings departments would work with us, because sometimes we cannot ascertain the routes of transmission. By carrying out site visits, we can find out possible routes of transmission and to see what improvements can be done. And so we can tell the public in what aspects do they have to be more careful. That's why we are trying to find out the route of transmission for better prevention. It is not always possible to find out the route of transmission every time. We cannot dial back the clock, but we are trying to find out how we can improve and find out the reason. This is what the interdepartmental department was doing.
What about the ventilation pipes? Anything to do with that? So what happens to the residents there? Well, for the ventilation pipes, so that's after the water seal. So basically, if you do not touch it normally, then there is no need to disinfect it because if it's not leaking foul gas or foul odor, then you don't have to do anything about it. So according to the guidelines from the DH, well, if you have not found out that any defects, then so long as you can close the toilet lid when you flush, it's okay. And then when I talk about the disinfection case, well, there was a confirmed case from that household. That's why, well, specifically for that particular unit, we try to pour in some bleach in order to disinfect the pipe. So last two questions. The one behind and then the one in front. Yes, I'm from Economic Journal. So I'd like to get the case number. So who lived in Unit 12 and so on. So can you give us the exact number? And also, you talk about further inspection. So when can you complete that? Because if you are not able to rule out the pipes, that might be problematic. But then what about the units that are opposite one another? So how come those residents do not have to be evacuated? And also for residents of Luk Chun House, they can move in and out freely. So is there any further chance of spreading the virus? Because we have negative cases being turned into positive cases. And also, what about the students? Should they go to the school? Should they go back to schools? Well, for 1084. He's living in Unit 12, and then 1089, and then 1092, same floor, and then 1090, Unit 10, and then 1091, Unit 12. And there is this newly preliminary confirmed case, Unit 12. As to whether or not they should go to the quarantine center for quarantine, or should they just give their deep throat sample, it depends on the risk factor. And of course, we are of the view that for those close contacts, they should be subject to quarantine. And then, generally speaking, well, for each and every case, we would not specifically evacuate everybody from the same floor or from the same unit with the same orientation. Because we haven't found other similar cases, and if we have to evacuate residents from other units with different orientation, then does that mean that in the future we will have to evacuate all residents from the same block to the quarantine center? So it depends on whether or not there is any suspicion that the transmission route might have anything to do with the structure and so on. So as soon as we identify such suspected cases, then we would do the same. Well, last time there was 4 cases. That's why we were very concerned. That's why we went there in the small hours of the morning to find out if that has anything to do with the pipes and so on. And then we found that well, just pipes couldn't explain that, and therefore it's more likely that it had to do with environmental factors or contamination. But then, as we are not able to rule out pipes defects today with this newly confirmed case, that's why we have to do more. Next. I'm from Hong Kong 01. Well, just now you said that, well, for Unit 12 and 10, well, the pipes might be the transmission routes. But what about Unit 14? Does it have Unit 14? And then is it connected to Unit 10? And also for the ventilation pipes being connected, what does that mean? Is it that they are sharing the same pipe? And also, well, this morning for the new positive case, well, initially he was tested negative. So does it mean that for those who have submitted samples, they could also be infected? And also, in a week's time, when you give further containers for them to give samples, then for the 6 households that have yet to give their samples, then what is going to be done about them? And also, when are you going to evacuate the rest? And also on the risk factor. So for all the ambulance men, would they be required to give deep throat samples for testing? And also, for those who are taking people from Bangladesh, would those ambulance men also be required to give samples for testing? Well, for the June 1st case, today he has been tested positive, and he started to display symptoms on the 3rd of June, and then he went to the hospital, and then on the 4th, that is today, he has been tested positive. Whatever test you do, well, you can only find out if he's infected at the time when he's tested. So even if he was tested negative initially, there is no guarantee that he would not be tested positive later, because we do have this incubation period, and it can be as long as 2 weeks. And therefore, even if he was tested negative initially, we would also have to ensure that he will be vigilant. He will have to be careful about his conditions, because the incubation period can be as long as 2 weeks. So after the initial contact, within the 2-week period, so even if you were tested negative initially, you would also have to take care of your physical condition. If you are sneezing, if you have runny nose and so on, you should go to the hospital for testing as soon as possible in order to make sure that it's okay. And you would also have to tell the hospital people that you live there. I'm sure the doctors there would also be doing the test for you. So how come you have to do another test after 2 weeks? That's because of the end of the incubation period is about 2 weeks. So on the 12th or 13th day, we would be giving containers to them so that they could give further samples, because upon the completion of the incubation period, if you're tested negative again, then you can be more rest assured that you're okay. And then for the ambulanceman, well, after he has been confirmed, at the Sha Tin First Aid Station, they were very concerned, and that's why we have given them containers for samples to be collected. And then, well, for all the samples that we have collected, they have been tested negative. And we are actually starting to evacuate residents from downstairs, and of course it takes time, because some residents just got the notification because they are still at work, and therefore we can only complete the process later on today. Sorry, speaker's not coming through. What about the ventilation pipes? Well, as you can see, well, for the toilets, well, there's water in there, and the purpose of that is to ensure that the soil or the soil pipe will not have any leakage. But then if there's too much water flushing, then there is a pressure that would take that water away. And then the purpose of having that is to balance the pressure, so that when there is flushing upstairs, then the water inside that pipe will not be taken away. So the purpose of having that there is to balance the pressure. What about Unit 14? I couldn't remember exactly, but then for 10 and 12, they are connected. But then 14 has nothing to do with Unit 10 and 12. It's disconnected from Unit 10 and 12. Okay, I'm from Economic Daily. All right, have you tested their fecal matter? Has that been tested positive and so on? So when are you going to announce the results? And you also said that 6 households could not be contacted. So have they already moved out? How come they have not been contacted? And also, you'll be asking them to give samples, and if they refuse to do that, what are the consequences? And you also said that there would be a second round of testing. So would that be mandatory? And if it's not mandatory, then how can you encourage people to give you the second sample?
Usually when a patient is admitted to hospital, our practice is if the patient has diarrhea or gastrointestinal symptoms, we would test the stool sample. It seems that they don't have these symptoms and they were not given these tests. So I cannot answer whether their stool samples came back positive or negative. The preliminary positive case today, he was given a deep throat saliva sample test today when he was sent to the ANED. On the 1st of June, it was negative, but today it came back positive. For the 6 households, the CHP, housing departments, and the police have never been able to find these households. So we don't know whether they are not living there anymore, whether they have moved out, they are not in Hong Kong, or if they, we don't know their whereabouts. We went to their home last night, late in the night, and today, 3 in the afternoon, we went there again, and they were not to be found. There were many households which we could not find, but later on we came to know that some households are living in elderly home, and other households have moved out or even left Hong Kong. So we don't know any information about the whereabouts of these 6 households. We need to confirm about how many family members are there in the households with the housing department, because they may have left Hong Kong. About mandatory testing, this is the 2nd round, so we are asking for cooperation from the residents. With the experience from the 1st round, we hope we can collect all samples this time. Of course, we cannot rule out the possibility of making it mandatory. What about the vent pipe? The soil pipe in Lek Yuen Estate is situated inside. So both the vent pipes and soil pipes are inside the unit. They are visible from the outside, but they are located inside the units. Are they located inside the corridor? No, they are located inside the toilets. This is 10, this is number 12, so there is a vertical vent pipe. Is it the case? Yes, correct. That's the end of the media briefing today. Thank you very much.